my name is Megan Slater with New Haven Residential Treatment Center, and this is the 7th in a series of videos to help us better understand ADHD. I want to talk about the tendency for ADHD people to be black and white thinkers. What that means is they're all or nothing. It's either this way or that way. Not very often do they have a middle ground or a gray area, and they'll come across very stubborn or rigid. In relationships, that's going to affect the people that they live with or that they're in a relationship with by causing arguments to happen where they're thinking that something has to be this certain way and the other people are trying to get them to see their point of view, and they have a very hard time putting themselves in the other people's shoes. I think a lot of their trouble with empathy comes from this place as well. The key for those of us with ADHD is that we need to be humble. We need to be humble enough to listen to the people around us and stop to think, maybe their point of view is accurate. You know, why is it that I'm so stuck on this one idea? We're going to see trouble with this in school or work performances because we want to be perfectionistic. We'll be the all or nothing student who either it's not good enough so I'm never going to do it, or I can't understand that and I'm never going to understand it. Or the other side is I'm going to do it the perfect way every time, and if this is exactly what the teacher said to do, I'm going to do it exactly the way they said to do it. Some of these kids, if they have a hard time finishing an assignment, instead of turning in half the assignment, they'll turn in nothing, because better nothing than not all the way done. It's important also for us to remember that if they can get, I want to say themselves stuck on something. If they can get themselves stuck on something good or positive, if they can be rigid about something positive, like a goal in life or a habit, it's extremely productive. However, if they get stuck on something negative, it's really hard to get them off of that. We'll see this a lot with addictions. A lot of ADHD people use drugs kind of as a way to self-medicate, to help themselves study or focus or feel calm, especially those who have not been diagnosed in the past. And so if we can get them stuck on something positive from a younger age, it's easier than when they're already stuck on something when they're older. So teaching someone who has already formed a bad habit or created a negative thought pattern can be difficult, but it's going to take repetition, and it's going to take that person recognizing that they may have something to learn. Again, the humility piece comes into play. Thanks for watching.